A spike in coronavirus cases. More than half the country, 26 states, seeing a rise in confirmed virus infections. Florida shaping up to be the next epicenter, according to the University of Pennsylvania scientists there. Researchers say that the risk there is worse than ever. The state reporting record high cases this week. Joining me now, Johns Hopkins School of Public Health professor, former World Health Organization collaborator, Fox News medical contributor, Dr. Marty Makary. Dr. Marty, good to see you this morning. But dig into these headlines. Are we seeing a rising number of cases in part because of more testing?
Well, good morning, Dagan. You know, we are seeing a rising number, and the concern is that it's not necessarily institutional spread. That is, meatpacking plants and nursing homes. This is from daily activity. Now, there is a high concentration of more cases among migrant workers, people that live in low-income housing, people that live in condensed situations under the same roof and take public buses to work, which is a controversy in Florida. That may be driving a lot of it.
But how do we prevent it then? I was looking at some research or some data that was reviewed by a Stanford medical professor. And this goes back to what we were told in the very beginning of this outbreak. 80% of Americans who've died from COVID-19 are older than 65 with the median age of 80. The whole point was to protect those most vulnerable to death, the elderly, and certainly in the case of New York, we did not, and put those elderly people in nursing homes at risk. So what are we doing to prevent a real rise in deaths from this virus?
Well, Dagan, the latest recognition by the medical community is that it is not routine brief interactions where there's direct contact or touching contaminated surfaces, but instead we emit from our own air when we breathe out these micro droplets, and that can essentially float in the air. So indoor areas with poor ventilation is being recognized as a major driver of spread. That's probably why we're seeing outbreaks in Austin, Texas, in bars among young people, even though their case fatality rate is lower. And it may explain why New York got hammered because of the poor ventilation in public transit and in elevators.
Right, which we kept the subways open for way too long. There's been research done by how it accelerated the spread here. If you wear this is a simple question. I'm on a bus going to work or going somewhere, public transit. If I wear a mask, can I sit next to somebody if they're wearing a mask?
Well, it's generally recognized that when distancing is not feasible, that's when you really need to wear a mask. And the risk, I would say, is reduced from about 50 to 60% rates of emitting viral particles down to 17% when you wear a mask. So it helps, and I do feel comforted when people are wearing masks closer together.
Right, it's mandated in indoor spaces now in California. We've got that. A new study, I want to ask you about coronavirus antibodies. A new study says these antibodies may only last 2 to 3 months after a person is infected. Your thoughts on this?
Well, if we look at, first of all, many people say we don't know, but I really feel strongly that there are enough surrogate indicators that the immunity lasts for years, because they do with the other known coronaviruses. If you look at SARS, if you look at MERS, these viruses give an immunity of at least 3 years, and we're not seeing reinfections. We've looked very closely now in China, and we are not seeing reinfections where patients are symptomatic.
That is great news. Marty, it was great to see you. Dr. Marty Makary, we will see you very soon. Take care.